Polycythemia vera is a rare blood disorder where the body produces too many red blood cells. This leads to thickened blood, increasing the risk of clots and reducing oxygen circulation. Let's break it down. Polycythemia vera is classified as a myeloproliferative neoplasm, meaning it's a type of blood cancer that causes an uncontrolled increase in blood cell production. The main issue: too many red blood cells leading to hyperviscosity, which is thicker blood that struggles to flow properly. Most people with PV don't have symptoms at first. In fact, it's often discovered by accident when a routine blood test shows high hemoglobin or hematocrit levels. But when symptoms do appear, they can include headaches, dizziness, vision problems, or even weakness. There may also be complications, which includes thrombosis, bleeding. Ironically, some patients experience excessive bleeding despite thick blood, and gout. Too many cells breaking down leads to high uric acid levels, causing painful joints. Other symptoms include itchy skin after a shower, erythromelalgia, which is burning pain and redness in hands and feet, which is relieved by aspirin, splenomegaly, which can present early on, and facial plethora, a reddish-purple tone to the cheeks and nose. Diagnosing this disease starts with blood tests. The key lab findings include high hemoglobin and hematocrit, increased red blood cell count, thrombocytosis, leukocytosis, high uric acid and LDH from cell turnover, low serum iron, since the body is using up iron for excessive red blood cell production, low erythropoietin. The body naturally reduces erythropoietin since red blood cells are already high, and JAK2 mutation found in 90% of PV cases. A bone marrow biopsy reveals hypercellularity, confirming excessive blood cell production. While PV isn't curable, treatment helps manage symptoms and prevent complications. The main strategies include phlebotomy, which is regularly removing about 350 to 500 milliliters of blood to reduce red blood cell count and viscosity, and aspirin to prevent clot formation. For high-risk patients, additional treatments include cytoreductive therapy, which is hydroxyurea, which lowers red blood cell production, mielosani, which is rarely used today, it's an older option, and radiotherapy of the spleen, which is rarely needed, but it's an option in severe cases. Supportive therapy includes antihistamines to help with the itching, allopurinol, which reduce uric acid levels to prevent gout, and proton pump inhibitors to protect the stomach, especially if taking aspirin. To summarize, polycythemia vera is a chronic blood disorder that increases red blood cell production, leading to thick blood and a higher risk of complications like clots and gout. While it isn't curable, phlebotomy, aspirin, and cytoreductive therapies help manage symptoms and extend life expectancy. If you found this video helpful, feel free to like, subscribe, and hit the notification bell for more medical content. See you next time.